Okay, so like Eamon said, I went to Lincoln University. I graduated in 2017. So I graduated in May and I sat for the NCLEX-RN board exam mid-July. So this means after graduation, from the point of graduation to when I took the exam, it was probably 6 weeks, if I'm not mistaken. It was like early July, so like between 4 to 6 weeks. And during the school year, you don't really have much time to prepare because I'm thinking about my final exam. I'm thinking about what am I going to do after I finish with college. So reality really set in after I graduated, and I'm like, okay, I can't even work or do anything without passing this next exam. So I wasn't really nervous about taking the exam because I felt like I was studying a lot during the school year. So I wasn't really worried about the test. And the reason why it took me 4 to 6 weeks after was I just needed to make sure that I had all my information before sitting for the test because it is expensive. It costs about $400, if I'm not mistaken, with the Maryland Board of Nursing. I'm not sure how it works in other states. So what I did, my school had a mandatory review course for everyone to do called Kaplan. So I took the review course. It was 3 days at John Hopkins University. We were there for 3 days for about 8 hours each day. They basically went over everything, over every system. They gave us test strategies, tips on how to pass, and then they gave us an access course to the Kaplan course, where they're able to give you some materials. They'll give you I think about 500 questions, but it was included with the course, and my school provided it. The only reason why I did it was because my school provided it. If my school didn't provide it, I would not have done it on my own because it was a lot of information. 3 days and covering every single body system, 3 days is not enough for you to fully understand it. It just felt like everyone was throwing information. So for me, I didn't really like the live course. But for some other people, if you're prepared for the exam and you just need a crash course, then those 3 days, the live session might be nice because you can't even ask questions because it's just so fast. They give you an opportunity to ask a question, but if you ask and you don't really understand, we don't have time for that. Like there's 100 other people in the room. They don't have time to fully answer your question or make sure you really understand. So for me, I didn't like it. For someone else, maybe. So that's just one of the things that are out there for people that are taking the NCLEX.
So is that only at Johns Hopkins, or do you know if any other schools or institutions offer that as well? Is that something people can do online if they don't have an institution that they can go to for that?
Thank you for your question. So there are different locations. It's not just at Johns Hopkins. For Kaplan, they have review classes all over the US. So in Baltimore, it was just Hopkins, but Towson offered it. And go to a hotel, they would pick a location if they have enough people to sign up for. So it's not affiliated with any university. Kaplan is its own resource. And there are other people, I'm pretty sure it's called Barkley Association, or I hope I'm not confusing that with the NP live review course. But there are people that offer the courses. It's not affiliated with the university, and it's not just that location. So if you go to their website, you're able to see when the next classes are being offered. And I'm sure with all the things that are happening with the coronavirus, then it would be probably like a Zoom or something like this, where you would be able to get all the information from an instructor. I hope I answered your question.
Yeah, that was really helpful. We'll try to put a link to that in a description for where people can sign up for that. Thank you.
Oh, and I'm going to share my screen for a second.
Okay.
And right here is the Kaplan. Is everyone able to see? Can you see it, Eamon?
Yep, I can see it.
Okay, and it even shows you right here, unlock your student discount. So if you put your name, put in your email address, reveal the discount. And basically this is what I used. They have the courses, the live course that I talked about. This is about $400. And again, I would not have paid this money if my school didn't make us do it. And it shows exactly what's being offered with the $400, like what's included.
So even though your school had you guys take this course and you said it was a crash course, do you think that it was still beneficial to you?
To some extent, yes, because they did go over they went over test taking strategies, which I thought was very important. With nursing, the NCLEX is trying to teach you, is trying to make sure that you know how to safely care for a patient. They don't care that you don't know all of the information. They don't care if you know how the heart is beating or if you're breathing. I mean, I'm sorry. They don't care if you know like all the structures in the heart or if you can locate the pancreas or this or that. They care, are you going to keep this patient alive? Do you know what the signs are to keeping this patient alive? Do you know if the patient needs, it's an emergency, what to do in emergency situations? So there's things like that I learned at the live course. Basically, every question you need to think A, B, C, airway, breathing, and circulation. So even if they're showing you a question and you don't fully understand, if you rely on A, B, C, does the patient have an airway? Are they breathing? Are they circulating okay? If not, then you have to pick the best option when it comes to, so that's something that they told me that really stood out, and I still remember that till this day. But everything else, reviewing all those systems, and not for me. Maybe someone else, but it didn't help me.
Okay, when you say that, is the patient circulating, you're talking about like blood flow, or how does that work?
Blood flow, yes.
Okay, good. All right, so like, and you said like you don't need to really know the position of the parts in the body, and that's like a lot of what the nurses learn in anatomy, right? So that stuff it's not really covered on the test, but it's covered heavily in nursing courses.
It's covered heavily in nursing courses because, of course, I'm not saying that you don't need to know the information, but that's not what they're testing for. They're testing if you're going to be safe, because you're new to the field. They don't expect you to know everything. So as long as you know the basics and you're able to show that you can safely take care of a person, then you'll pass.
Okay, great. We have 2 questions right now, so we'll go with the first one, and then I'll tell you the second one.
Okay.
So everyone, I think we can see the question on screen. So someone asked, do you think that your school actually prepared you to take the NCLEX?
So maybe you already know how I felt about my school, but there was a lot of, like, I'm not going to sit here and bash my school, but there was a lot of self-learning for you too. They might not guide you how, I went to a school that when I started, it was their second year of having a nursing program. So there's a lot of issues, a lot of things that they haven't worked out yet, that they're kind of experimenting with us. So there are a lot of things that they didn't do to really prepare us because they didn't know, but I wouldn't blame them, because at the end of the day, you want the degree, you want to pass, you want to be a nurse, so you need to take that up upon yourself to, study harder or go out of your way to do something on your own. You can't rely on the school. I mean, it'll be nice if the school helped, but for me, not really. It was just a lot of self-studying, and I worked better that way, studying by myself. We'll learn something in class, but I need to go back and read it, and then I'll be able to grasp it.
Okay, great. Yeah, it sounds like even though the school was new in the nursing program and how everything worked, that you still learned something from it and learned skills for yourself that showed you that you had to be motivated and take on ownership of the program. We
Right.
have one. We have another question here. Let me see. I'll put it on the screen for us. If you could redo anything in preparation for your NCLEX, what would that be? That's a great question.
This is a question, and it leads to something that I want to talk about. I would say not to waste too much time between graduation and test taking, because there are a lot of things that you learn about the school year. And I was like, I was really nervous, but I was just like, no, I need to do this. I need to know every little part of the heart. None of that was on the test. It was, are you a safe nurse? Can you, if somebody's blue in the face, can you tell me that to call for help, not just to be like, hey, are you okay? Are you like, so you know what you know and go for it. That's what I would say.
All right, so take that test as soon as you can. How soon do you say, like, you graduated? I mean, you finished yesterday. Are you taking it 3 days later on Monday? Is it a week? Do you review a little bit, but not too much to overwhelm yourself with like all the anatomy and things that's not tested?
Like, I know different people do it differently. Like, some people can graduate today, they'll test tomorrow. Some people would take 3, 4 months to like make sure they have all the systems and study. But it's up to the individual. Because for me, if someone told me that, I'll be like, no, I need to make sure I know all this before sitting down because I $400. I want to pass the first time. So it's up to the individual.
Got it. Okay, so you said pass the first time. So if someone doesn't pass, is there a limit on how many times they can take the exam, or is it like as long as you keep paying us $400, you can take it as many times as you want. We want your money.
After you fail if you take the exam and fail, you have to wait either 30 or 60 days in order to repeat. Then you're able to repeat the test. And then I think you can only take it up to 3 times during a year. Because yes, they want you to keep paying the money, but they don't want you to just keep taking the test. Like, they want to make sure that you're actually taking time to really review.
Right. Okay. Great. Okay, so we have a couple other questions.
Oh.
So this one here, let me put on the screen. Someone's saying, so are you not recommending Kaplan? You talked a lot about like the 3-day crash course and how intense it was, and are you recommending that, or do you not recommend it, or is it based on the individual?
Thank you for your question. So I said Kaplan had that live course, and then it also had questions that you can answer via their website. Like, all of that was included with the $400. So for me, if you know all of your information and you feel ready, get that crash course, get all of that. While the person's talking about it, you're just like, yeah, I know that, I know that, I know that. I know all of this, so why am I like? Then if you need that reassurance, then yes, go for it, because it is helpful to some extent. But for me, the live course did not help me. But
Okay.
the online Kaplan questions, the way that the software is, it looks just like the NCLEX. There's like a little blue bar on the top, and then the way you have to answer the questions. So if you want to be familiar with the setup of the test, Kaplan looks good for it.
Okay, good. Thank you so much. We have another question, and someone asked, what helped you to succeed in nursing school? Like, what's your number one tip, or your number, couple of them?
So you want number one, or you need a couple?
You can do 2 or 3.
I would say kind of what I talked about earlier. You can't rely on the school to give you everything you need. because it's your goal. So if they don't teach you this, they don't teach you that. What are you going to, during the test, you're going to say, oh, my school didn't teach me that, I can't. No, it's up to you to really want to learn. So I would have to say just study. When you don't feel like studying, study some more. When maybe you're like, why do I have so much free time? That means you need to study. So definitely studying, prioritizing, because yes, you have NCLEX online, but you still have other courses to take. You still have a rotation to do. So it's like during the rotations, you have to do like some sort of documentation, and you have assignments to turn in. You have discussion boards. So I would say prioritizing. Okay, I'm going to give this amount of time to get this task done, and then do this, and then study for my class, and then maybe study for NCLEX. Something else that I wanted to talk about. No, actually, I'll finish with this and then I'll talk about it. But it'll help with the question as well. I don't know. That's my tip: study and prioritize, because there are distractions. So you just need to know what your goal is. So just attack that, and everything else can wait.
All right. Thank you. So you said to study, and if you have free time, study again. Where do you find a balance between studying, taking breaks? Well, everybody's going to have their own study habits and their patterns. Maybe they study for 3 hours, then they take a 2-hour break or something like that. So everyone would just figure out their own study schedules, not necessarily 10 hours a day straight.
No, I wouldn't say that at all. Even when studying for NCLEX, no, don't do that. Like, study for 2 hours, give yourself 30-minute break. If you're studying and all the words look like the same words, then you need a break. I've seen something, I didn't do this, but I saw something like someone will put like a little snack after a few pages. So after a few pages, they'll know to take a break from studying, eat the snack, walk around, stretch your legs. Like, you want to study, but you also want to retain the information. So while I'm saying study, but make sure you're retaining and you remember what you're studying. That leads me to writing down while you're studying. Don't just read. You need to take notes. You need to highlight. You need to say, get back to this later. You need to say, refer to my patho book. I also used something called Saunders Comprehensive Review, which is a book like this thick, this full of all the body systems. It gives you test strategies. It has questions in the back with answers, and the review of the answers, like why this is the answer. So that was very helpful, and that goes system by system. I will share my screen again.
Okay.
And show you what the book looks like. This is what I use, 6th edition.
And the book's not that expensive, $17.80.
Exactly. So it's not that expensive, and it's the best. It also has like a CD attached to it where you can go and do the questions that way. Then also I had this Saunders review flash drive. I mean, not flash drive, sorry, flashcards. So this is what it looks like. This is the 2nd edition. I'm not sure if there's a more current edition. Ooh, this one's a little pricey.
Yeah, the flashcard's $218, but the book is $17. It looks like you can get a used one for $63, it looks like.
Right. Yeah, I don't think it was this pricey. It was gifted to me, so I can't really. So maybe ask for it as a graduation gift. Like, please, someone, mom, dad, friend, brother, please buy me this. That's what happened. My sister bought me the flashcards. So even when I didn't have access to the book, I would just, like, if I was, let's say I went to the DMV, I would be flipping through the flashcards. There are tons of questions with the answers right on the back. So you're able to go through that. And that's another review in itself. And then there's tons of apps out there that you can also use if you don't want to carry the flashcards around. You have your phone. They have tons of questions, and then you can do that. You can get in study time that way, or just to review for yourself.
Great, thank you so much. We have another question about studying. Someone asked, how long was your personal study time outside of the programs that you did?
My personal study time. I would say I couldn't study at home. So I would go to the library in the morning with all my supplies, and I can't say that at a set time I went every day, almost every day. The days I didn't go, that I would study at night. I wouldn't say I had a set time, but that might be helpful for some people, just to have that structure. Like, you need to do this at this time, and just basically have some sort of repetitive pattern, so you'll know I need to do this every day. But I can't say I set like a standard study time. I just went, finished reading that book, and then I went and did questions on something called UWorld.
Okay.
After I finished the Saunders book, I went to, it's called YouWorld, and you have to specifically click for NCLEX-RN, because they also have exams like the LVN exam. They have the exam for new graduate doctors. So it's a very reputable source. And then the way the questions are set up is just like the NCLEX. And the rationale that they give are very, very helpful.
Is that uworld.com?
Yes, and I also have I will also share that on the computer.
All
If you
right.
type in UWorld RN NCLEX.
Okay, everyone can see that. Perfect.
Loading. And here you go.
Okay.
NCLEX-RN with ease, and they're not lying.
Wow.
When
yeah,
you
let's see the price.
Yeah, it's a little bit pricey, but I will say that it's worth it. I did the 3-day access for $129.
Okay.
And it has 2,000 questions.
So do you?
Little. When I did it, I also was able to get the 2 self-assessments, but it was a 30-day access.
So if someone could only buy one of these programs, would you recommend UWorld, or would you recommend those Kaplan cards? Because this UWorld is just about the same price as the, it's the NCLEX cards, the index cards. It's $200. The UWorld is a little cheaper than that. So which one would you recommend?
Look, you're gonna have to
spend some money.
Like, I would say spend I have to tell some people, like, look, this is my graduation gift. These flashcards and this NCLEX. And the UWorld. But no, anyway, I would say the UWorld. The UWorld has very good rationale. It'll start from patho, it'll have pharmacy, it'll have health assessment, it'll tell you everything, it'll have pictures, it'll have sounds if need be. Like, I'll say UWorld any day.
Okay, so if you had to rank these things, it would be UWorld first.
Yes.
Then the NCLEX book and the index cards, and then Kaplan.
I wouldn't do UWorld without reading Saunders.
Wow. Okay. We're going to link all of this in the description as well.
Yes,
There's a lot of materials.
So
yeah,
read
sorry.
the Saunders book. If you can't afford the flashcards, then that's fine. The Saunders book has everything. The flashcards are just for something to do on the go, but
Okay.
the book is important. Read the book first, and then do UWorld when you feel like you've reviewed all the information in the Saunders book.
Okay, got it. Read Saunders' book first, then the flashcards, and then YouWorld. And then Kaplan can fall in anywhere between those, or?
Like I said, Kaplan wasn't very useful for me, but Saunders
Yes.
and UWorld, perfect. The perfect combination.
Okay. Well, if anyone have any other questions, or Gloria, do you have anything else to add? Any final words for anyone who is a nursing major or working through the rigors of the nursing major? I know it can be challenging. If you have anything else to say, and we'll just keep an eye out here for any last minute questions. If anyone has any questions, feel free to comment those. So yes, Gloria, any last minute tips, advice, anything?
I mean, I talked about everything I wanted to talk about. I would just say, you know yourself, you know, if you're answering questions, you get 10 wrong, keep studying. It's okay. There's no rush. You'll be an RN. Like if it takes you 2 months to cover everything, that's fine. As long as you know you're prepared. If you've answered 100 questions in a row perfectly, go take the test. Like, why are you got the information, go take it. But if you really feel like, no, I'm not ready, then it's okay to go back to the drawing board and re-strategize. But I wouldn't take the test if I'm not confident. That's what I would say. If you're not confident, then keep studying until you are confident. You can definitely tell with UWorld because you're able to, let's say, select 75 questions and put it in test mode. So you're acting like you're actually in the test with the timer, and the breaks that you would have in the actual test, it'll all be included there. So if you do well with that, then go take the test.
Got it. So you used an example and said, if you get 100 questions right, go take the test. What is the benchmark for that? I don't know how many questions they have on a test. How many questions do they normally have?
So with the NCLEX, the amount of questions you get is up to your performance test, because someone can pass with 75 questions. Someone can pass at 150 questions. The test it's a smart test. So it'll change based on how well you're doing or how not well you're doing. If you get 10 questions right, it'll keep asking you harder questions. And if you know you're getting hard questions, then you're doing well. That's why a lot of people leave the test thinking that they failed because, oh, all the questions were hard. That's because you were doing good. Once you start getting like the basic questions, like where's the heart, left or right side, then you should be, then, you know, maybe you're not doing as well. But once it says, the patient's vital signs are this is their sodium level, do you want to call the doctor? Do you want to start with IV fluids? Then you're like, okay, because it's actually making you think. But if it's something basic like, what's the side effect of heparin? That's a pretty simple question. So it'll adjust itself. So the lowest amount of questions you can get is 75. The highest amount, I do not remember. I think it's 325, but don't quote me. So it'll adjust based on how you're doing. Like there's not a standard amount of questions that you're going to get. But you definitely want to be yourself in case you get the full amount of questions.
Right, that was perfect. Thank you.
Mhm.
Anyone? I don't see any questions that have come in since I've asked for them. So I think we're all good to go here. Thank you so much for sharing your knowledge and your experience with us.
Not a
Maybe we'll have you back on another time to talk about another step of the journey. All
awesome.
right then.
Thanks for having me.
Thank you so much. Bye everyone.
Peace out.